Welcome back. My name is Dr. Carl Baird, and today I'll be showing you how to fix shoulder pain by improving your mid-back mobility. So over the course of my career, I've helped a good number of people solve their shoulder pain, and there's always a few principles that I want them to understand before getting started. The first is that shoulder pain in most cases is not a shoulder issue. More commonly, it's a movement issue that leads to more stress on your shoulder. So what we have to do is not just become hyper-focused on the shoulder, but look at how you're moving as a whole and fix the things that are causing all this stress to be put on your shoulder. So that's part of what we're going to be doing today by looking at your mid-back mobility. The second thing that's important to understand is there's a very big difference between a plan to solve or relieve shoulder pain and one to actually fix the issue for long-term solutions so that you can keep active and keep doing what you love. When it comes to relieving shoulder pain, it's very, very easy. Pain pills, injections. I mean, in the shoulder, if it's your right shoulder that hurts, I can punch you in your left shoulder and your right shoulder is gonna hurt less. That's how easy pain is to manipulate. And so what we really wanna do if we wanna fix shoulder pain is correct the underlying causes. And what we're going to do in today's video is show you how your mid-back plays a role in shoulder pain and then what you can do to improve your mid-back mobility to help fix shoulder pain. So strap in, let's go ahead and get started. The first thing I want to do is show you how your shoulder movement is directly linked to your mid-back movement. So you can see why it's going to be so important that we address the mid-back when it comes to fixing shoulder pain. So when I say mid-back, what I'm referring to, it's called your thoracic spine. It stems from the bottom of your neck to kind of right below the shoulder blades or your mid-back. And it's an area that gets stuck on a lot of people, right? Especially people that sit in front of a computer, kind of typing all day. Those joints, those muscles, they can just get stuck and it makes it hard to move around. And that becomes a problem with shoulder pain. So I'll show you what I mean. So if I'm sitting up nice and tall, I have a nice loose mid-back. When I come to bring my shoulders up, I can get, again, my biceps to my ears. That's about the range of motion that you want. But if my mid-back or thoracic spine is stuck in this rounded position, which is a pretty common thing to see, when I bring my arms up, my shoulder range of motion gets stuck right there. So I can't get it all the way up where we want. And this becomes a big problem with somebody who uses their shoulders a lot, or let's say you're getting back into exercising and you're doing like an overhead press, and instead of being able to press straight up, you got this stuck mid-back and your press looks like this. That's gonna put a lot of strain, a lot of stress on your shoulders. And so it's really important to address in a plan to fix shoulder pain, because again, you can relieve the shoulder pain with massage, but if you immediately go back to that stuck mid-back and keep doing this over and over, it's going to be days, months, years, but that shoulder pain is going to come back. So that's why we want to assess and address this mid-back mobility. And now I'll show you how to improve your mid-back mobility to fix shoulder pain. So now I'll show you two of my favorite exercises to improve mid-back mobility to help fix shoulder pain. The two ranges of motion that we're really going to focus on are extension. So again, to counteract that kind of flex spine position, we really want to help open you up. And rotation. So I'll show you two different variations of the exercise. You really only need to pick one just based on your ability level and comfort level and be consistent with that. To perform most of them, it's nice to have a foam roller. And so we'll start with what are called foam roll extensions. So you're going to start on your knee. You're going to shift your hips back, but you're not going to go all the way back. You're going to put your pinkies on the foam roller, and then you're just going to extend those arms out and really focus on dropping your head and trunk down. And so you should feel a nice stretch on the outside of the shoulders, but also that extension in the mid-back should feel like a nice stretch too. And it's just going to be about a second hold, and then you're going to roll back up. So it's not a static stretch, and you're just going to move in and out of this position, trying to get a little bit lower each time. The next foam roll extension variation, you're going to actually flip over and you're going to put the foam roller, I usually start right below my shoulder blades, my knees are bent, my feet are flat on the floor. I'm going to put my hands on the back of my head so that when I drop down, my neck doesn't extend like that. We want to protect your neck, but from there, all we're going to do is drop your shoulders. Same thing, hold for about a second, and then come up. And then you want to work up and down your thoracic spine. So to do that, I'm going to press up through my feet to lift my hips, bring my hips down just an inch or two, and then we're going to do the same thing at the next level of that thoracic spine or that mid-back. And you just kind of work your way up and down, really working on that mid-back extension. So it usually feels pretty good. Next one, we're going to move to rotation, mid-back rotation. So what we're going to do is start on our hands and knees again. First one is a foam roll rotation. So again, this is the easier one to do. What we're going to do is start with the foam roller on the side. I'm going to take my pinky edge, and what I'm going to do is put that under this top arm onto the foam roller, and then all I'm going to do is roll it out. And it's okay to kind of bend this elbow and drop your ear to the floor. You want to feel a stretch on the back of the shoulder and into that mid-back. Same thing, you're going to hold it for a minute or a second and come back up. And you're going to move in and out of that position. Again, trying to get a little bit further each time, really trying to push that end range to improve that range of motion. And then make sure you do both sides to even it out. And if that feels pretty good and you want to move to the more advanced variation, it's a thread the needle without the foam roller. So it's going to be the same thing where you're going to take your left hand, you're going to come under and really reach, and then you're going to take your top hand and you can really open up the other direction. And then again, make sure you do both sides. So right hand, reach under and reach up. So there you have it. Those are two variations to improve thoracic extension and rotation. So the last thing before I let you go is just a reminder that improving mid-back mobility takes time. It takes patience and it takes consistency. Remember, this stuck mid-back didn't happen overnight. It's probably been the accumulation of days, weeks, months, years of sitting in a certain position. So we have to be consistent with these exercises if we really want to improve mobility to fix shoulder pain. So that's all I got for you. Thanks again for watching. If you have any questions, don't forget to leave them in the comments below. I read them all and I'm happy to help. Thanks again. This is Dr. Carl Baird with Solving Pain with Strength. Hey, it's Dr. Baird here. Don't forget to subscribe to our YouTube page to catch all our videos designed to help you build the strength and confidence to live active, healthy, and happy lives. You won't find it anywhere else.